Have you heard the scary news stories about how strangers are going to taint kids' candy with pot now that it's getting more legal? There's no evidence for that. There's also no evidence that strangers poison kids' Halloween candy in general. That's the topic of this week's Healthcare Triage.
Well, a well-known Hoosier doctor has become somewhat of a YouTube sensation with 500,000 subscribers. Dr. Aaron Carroll's YouTube channel offers more than a dose of medicine. There's also some entertainment value. Business of Health reporter Kylie Valletta is back in studio with more. Kylie.
Thank you, Gary. Are mushrooms really better than antidepressants for treating depression? Or all that rage about stand-up desks, do they actually have any significant impact? These are the types of questions that IU Chief Health Officer Dr. Aaron Carroll tackles on his weekly YouTube show called Healthcare Triage. And like any good health medical professional, he relies on research and evidence to do it, but he also makes it fun. And perhaps that's why the show has nearly 500,000 subscribers and some of the videos more than 1 million views. A key goal of the show is to be a trusted source for health information. So one of his favorite topics to dive into is a health story that the media isn't presenting accurately.
When I see bad news stories that are covering questionable research in ways that shouldn't be, we sort of love, nicely attacking and dissecting those. I think, too often questionable research is used to scare people, and I really enjoy when we can, bring people back to normal. We try to take good research, data, and evidence and show how they should be applied to people's conceptions about health. If you told me that we would have someday, 500,000 subscribers, or that, tens, if not hundreds of thousands of people would watch videos on topics that I think are important, I would be blown away. No, I never thought we would have this. It's absolutely joy. It's one of the few things I think I'd never, ever, ever give up as long as I don't have to.
And Dr. Carroll says he has no interest in becoming the next Dr. Oz. It's just a fun side project for him, and he truly enjoys his actual job. The show is completely independent, not associated with IU in any way, and mostly viewer support.